Located in the heart of Benue State in the north-central part of Nigeria, you are welcome to the Benue State University Teaching Hospital, a beacon of hope and healthcare in Nigeria. Today, we will be taking you on a journey through the corridors of this esteemed institution where dedicated medical professionals work tirelessly round the clock to save lives and improve the healthcare of its immediate community and patients from across the country. Healing hands in the heart of the Middle Belt, the transformative story of BSU Teaching Hospital. With a team of experienced doctors, nurses, and support staff, the hospital offers a wide range of medical services from emergency care to specialized theater for carrying out surgeries. However, this did not just happen overnight, as before the present administration of Governor Hyacinth Alia, the Benue State University Teaching Hospital faced numerous challenges which ranges from inadequate facilities and equipment, as well as shortage of skilled staff, which hindered the hospital's ability to provide quality health care. But the emergence of Governor Alia as Executive Governor of Benue State, there has been a significant transformation in the institution due to his bold vision in transforming BSU Teaching Hospital into a world-class healthcare institution. He prioritized the infrastructural development of the institution and recruited specialists to the various departments, as well organized staff training periodically to upgrade the knowledge of the practitioners of the university. He also appointed Dr. Stephen Wande, a dedicated and well-trained medical doctor with wealth of experience, as the Chief Medical Director of the teaching hospital to oversee its operations.
Another key component of this event is the launching of an endowment fund for the establishment of a cancer center here at the university premises. Please, I urge all of you to continue to participate by contributing your quota to this noble cause. I commend the Chief Medical Director of the Teaching Hospital, Dr. Wande, for this bold initiative and urge the entire management team to work towards making this International Health Investment Summit and scientific exhibition a yearly event. This is important because health promotion is often not given the needed attention it deserves, and is sometimes thought of as a minor and not a major or core health care, but its importance cannot and should never be underestimated. Cancer has been responsible for 79,000 deaths, approximately 124,000 cases in Nigeria each year, accounting for the second highest cancer burden in Africa. New approaches and collective efforts are needed to reverse the ugly trend. Therefore, promoting health through the life course is becoming more important than ever before, which explains in part why our administration is committed to increasing health expenditure, as evidenced in this year 2024 approved budget. The result of this commitment is that the narrative of poor budgetary allocation to the health sector was intentionally being reversed. When we took over the reins of government about 1 year and 2 months going, we realized that there were so many challenges of development to be tackled, including that of providing excellent, relevant, and affordable health care for the people of the state. So given that the health of the population is a key determinant of its productivity, we immediately swung into action by deliberately introducing innovative approaches aimed at increasing access to quality healthcare delivery in the state. However, to understand the changing tides in Benue State is to appreciate the resolve of our administration to do things differently and to toe the unpopular paths to many. In fact, to toe the unpopular path to a very few who claim unjustifiably certain rights. It has not been easy, but in a clear vision and dogged commitment to good governance, we are making steady progress. For instance, recently, our administration granted approval to the State University Teaching Hospital to employ over 500 staff in various areas of specialty to enable the hospital rise to the challenge of providing excellent healthcare to the field, and to also tame the tide of unemployment in the state. Our administration will continue to be upright, uphold the tenets of best practices, and prudently utilize available resources at all times for the consolidation of a virile and effective healthcare system in the state.
Governor Alia has several times directed the Chief Medical Director to facilitate training programs, workshops, and conferences for medical and non-medical staff to advance their knowledge for optimum productivity. In the area of improved welfare packages, the governor has implemented policies to enhance the welfare of employees, including prompt payment of salaries, provision of housing allowances, and access to other benefits. Recently, the governor's unwavering commitment to the welfare of the state's workforce has directed the release of funds to clear significant arrears owed to the staff of Benue State University Teaching Hospital by immediate past administration. This does not only relieve the financial encumbrances faced by the healthcare professionals, which demonstrated the importance he attached to investing in the people who are serving the community. A breakdown of the outstanding arrears, which highlights the challenges that have plagued the healthcare sector, which noteworthy expenditures include 2023 promotion arrears, 13 months, 2024 promotion arrears, 1 month, relativity allowances for honorary consultants, 2 months, hazard allowance arrears, 21 months, accountment arrears, 2023 to 2024, staff death benefit arrears, respectively. In addition, the release of 398,568,662 naira for the reviewed Conhairs and Conmares monthly payment further demonstrates the governor's unwavering intent to ensure that healthcare workers are fairly rewarded and compensated on time.
When it comes to development, there are no politics. Most success people appreciate that. Does cancer no politics? Does cancer no is in every ability? So allow us to appreciate the gentleman who is genuinely interested in the development of the state. And I think that our governor is interested in that. If we have a center here, it reduces the cost of treatment because it costs, at $4,000. What population that will feel with it all contact? Who that has sitting here? How many of us seated here and our forces sit there? We treat harassment. So the nearer the better. Even if you have 1,000 years to pay, you put it because tomorrow you don't know if it be your mother, your father, your brother, or your relative. But you could have a cancer center here. The money that you need to take him or her to Abuja or Bodegos as the presenter at this keynote speaker here and say, we'll be spending less of that money here.
After his appointment, the Chief Medical Director promised not to disappoint the governor and Benue people as he immediately hit the ground running with notable capital projects, which includes the establishment of a cancer treatment center which will aid early detection and treatment of cancer. The center will change the narrative of cancer management in Benue State and the North Central region. The administration also established a drug hub store, school for persons with disability, MRI scanning machine, stable power supply, and a 230 liters capacity water treatment plant, a VIP word among other projects.
You know that this teaching hospital is a very big one, addresses about 1,000 persons every day. And you know the needs. It has about 400 bedded capacity. And these 400 persons have relatives, some even two. They have workers that come in and go out. You have patients that come in as outpatients and go out. Then you have the doctor's quarters, and then you have the student hostels. That tells you how can you run this kind of hospital with boreholes. And then so you know that for 13 years, only one governor has been able to identify this need in the hospital, one governor, who is just about 2 years. And this same governor is doing the cancer project. This same governor has brought the molecular lab. This governor has brought the Center for Therapeutic for Children with Special Needs. This same governor has brought in the pharmaco-surgical complex. This same governor is bringing in VIP. This governor has brought in molecular lab. This governor is bringing additional office complexes. This same governor has cleared areas, 21 months of hazard areas left by a previous administration. This governor has cleared 5 years death benefits of all workers, over 30-something who died for over 5 years. This same one governor has done all this. This one governor has upgraded the salaries of staff here. He's paying them the same thing as federal is paying. This alone is just in the teaching hospital. They're giving them the new salary structure. Has employed over 1,000 in all facets. 1,000 workers. I met 1,000 in 1 year. He has added another 1,000. And this governor is doing all this just in the teaching hospital. Has not borrowed one kobo. Today, this is the second teaching hospital that is doing IVF. The cheapest. You pay 400,000, you just buy your drug. IVF. This test tube baby, you hear these big stories. Under 1 year, this hospital is doing assisted reproductive technique. People have delivered in this same hospital. This hospital is now doing minimal access surgeries. The MRI is now functional and serving the people. This hospital, but when you see, we have established postgraduate schools, 4 nursing postgraduate subspecialties. All this, for me, is 1 year, 6 months. Then this Servicom that we are providing here is one of the practices globally, where you should have one central point where if any issue you have that troubles you, we had already earlier given emergency numbers for people to call when they have issues. But we have noticed that people have not even called those numbers, and then they have gone online. Now we are bringing in a physical structure in the center of the hospital, where if you have issues, you come and put it in writing. Because the truth is that we're in political days where people just want to pull people down when they have failed during their own time. So this Servicom is to serve genuine, because we know that there are those who want to politicize everything, including security, for their own glory. But this one is, if you have a problem with BSUT of service, they will give you a book, you write it down, we investigate and solve your problem. And then, so we are putting those issues of Facebook to the end now. You have online numbers and you have a physical place that is on 24 hours of the day to address your issues. If you come to BSUT now and you have genuine complaint as our patient, you write your card number You write your complaint. You write where you are being seen and the complaint is there. Then we will go through and solve it. You will come back and countersign that has been done.
The management staff of the hospital all heaped praises on the administration of Governor Alia and the chief medical director of the hospital. They say it is a prayer that was answered by God, as the people of the state has long dreamed of a day like this in the history of Benue State.
Accreditation in family medicine in the National Postgraduate Medical College of Nigeria. There's accreditation also in the West African College of Physicians, also in the Family Medicine Department. That is 2 accreditation already. We went to the laboratories and we had accreditation in all the 4 laboratory departments.
Just last year, His Excellency approved monies close to ₦1 billion to offset arrears of hazard allowance that has been owed in this facility for 21 whole months. Needless to say, that before His Excellency's coming at the coming of the CMD, we were operating a factory 5,000 naira hazard allowance that has been there for years.
The governor has supplied to us radiological equipments that have made our service delivery seamless. Before now, you send patients to go to Abuja to go and do a CT scan, to go and do MRI, and bring reports for us to treat. But now these things are available in our hospital.
There was no Department of Planning, Research and Statistics. Like I said, one of the cardinal points of the teaching hospital is also to provide and research. So the Department of Planning, Research and Statistics was set up. And again, just of recent, after some time, he still saw the need to bring on board another department. But before he could do that, he sent various senior staff within the Directorate of Administration to go on a study tour in sister organizations.
Before then, we used to collect samples from patients for hepatitis, B, hepatitis C, viral loads, and we would ship those specimens to Abuja, to Kaduna, to run those samples. It takes 1 month, 2 months before we bring the results. Then we give back to the patients. So when this place was opened, with the commissioning of the place, installation of the PCR machines, that issue was largely solved. The patients will not really have to wait for too long to get their samples, so that the doctors will control their treatments in the way they should.
For the patients and their loved ones, the transformation of these tertiary health institutions in the state is an answered prayer, as they no longer have to go long distances to access better health.
Mo kashamba ko hataka kulu sombu nanguka tu sombu kera mo ha kayo ya ngoma ba yo ngomo kala fa ko aga wan ba na ko mo ha ne ya higen fa ko wan ko ba tiro mu yi mo nya ga jama nanga o nya lo yi nanga o yi lo yi higen hama kwa mpa ko tuna na donza ataba taba shima wasanse ataba shima sha njayele na hiyo china angbanu gan pa ba wana e wala na ha.
Brought here on the 27th of April in the evening around 7:30 p.m. like that. So on arriving the emergency unit, let me say I commend the CMD so much for his work he's doing. Yeah, and the Governor of Benue State, His Excellency, Reverend Father Dr. Hyacinth Alia, together they are doing a wonderful job. The services are very nice, very okay. Yeah, they treated me very well. You know, it's a neck shot, and you know how severe it is. So I thank God they are doing a very wonderful job. The doctors are attending to me, and the nurses, they are doing a very wonderful job. I commend them for that.
I want to appreciate His Excellency and the present Governor of Benue State and the CMD of Teaching Hospital. Because 2022, I was here with my brother-in-law. We stayed in the hospital for over a month, and the services wasn't good because I remember there was a certain time he was on MPO, and the cannula got tissued. We waited for us to see the doctor because we went to the nurses, we complained. They say it's the doctor that is going to fix the cannula. So we were there, we couldn't see the doctor until around 5 p.m. when we began to make calls here and there, call doctors, call family and friends, which we know from the facility. But this time around, I want to appreciate them so much because yesterday I was here. I came for an emergency. I was so much impressed at the emergency ward because there were so many doctors, in as much as there were plenty of patients there. There were many of doctors. They were so patient and understanding with us. Like somebody like me, when I came, I was so much in tears. So the way I was like talking to the doctors, I was like asking them plenty questions. I was expecting them to like react to me quickly, immediately. Other doctors might get angry, but then they were so calm, understanding with me yesterday. I think they treated all of us equally the way we were expecting it. And they stayed with us there from 5 p.m. till 5 a.m. this morning.
Other areas of achievement include renovation and furnishing of 200 capacity cafeteria block, renovation and remodeling and furnishing of nutritional block, construction and furnishing of therapeutic center for children with special needs, construction and furnishing of drugs, reagents and consumable store, renovation of doctors' quarters, construction and furnishing of office complex A and B, construction of 600-meter perimeter fence, renovation, remodeling and furnishing of VIP clinic, renovation of Muhammadu Buhari Mother and Child Annex, remodeling of IVF center, renovation of students hostel, renovation of academic block, renovation and furnishing of amenity wards, renovation of administrative block, provision of parks, horticulture and gardens, erosion control systems. Medical equipment include supply of ophthalmology equipment, supply of MRI compatible wheelchair, supply of MRI compatible patients monitor, supply of other medical equipment, supply of office furniture, supply of computers and accessories, supply of air conditions, refrigerators and stabilizers. The list is endless. The transformative narrative of Benue State University Teaching Hospital is a testament of the power of visionary leadership and collaboration between His Excellency Hightense Alia and Dr. Stephen Wande. Their effort and collaboration so far have made a lasting impact on the lives of countless patients and families. As the Benue people look to the future, Benue State University Teaching Hospital is a shining example of what can be achieved when people come together to make a difference.